Jeremy Hunt and Hammond gridlocked over funding as Theresa May plans to rescue the NHS. The Health Secretary and the Chancellor have failed to agree on the percentage increase to be received by the NHS in England from next April. The Health Secretary is hanging on for a rise which would bring NHS England's budget to between £157 billion and £160 billion. This is an increase of up to £32 billion by the end of this Parliament in 2022 to 2023. But the Chancellor is worried about the impact of such an increase in health spending on wider public finances. A source close to the negotiations said, "They are gridlocked between the completely different amounts, either 3.3% or 4%. A Whitehall source added, "They are not miles apart, but equally they are not inches apart either." Mr. Hammond, Mr. Hunt and Simon Stevens, the chief executive of NHS England, met on Friday to negotiate a deal. The trio met at 11 Downing Street, the Chancellor's official residence. Their talks followed reports Mrs. May is planning to boost NHS funding between £4 billion and £6 billion a year. The main disagreement between the pair is over the percentage of the annual increase to be received by the NHS every year from 2019 to 2020 until and including 2022 to 2023. Mr. Stevens, the Institute for Fiscal Studies, the Health Foundation and NHS bodies have made clear the service needs a 4% funding boost, but a 3.3% increase is the very least it must receive to continue to meet demand. The Health Secretary has endorsed the 3.3% figure as a minimum. But Mrs. May believes anything less will mean the NHS is unable to significantly improve its performance. According to analysis by the Health Foundation, a 4% annual rise for the next 4 years would increase the NHS budget by £32.3 billion, bringing its total £160.5 billion by 2022 to 2023. An average hike of £8.1 billion a year. But if the rise stands at 3.3% it would bring the budget to £156.2 billion, an annual increase of £7 billion. Mr. Hunt and Mr. Stevens are hoping to persuade the Chancellor to agree a rise of at least 3.5% so the NHS can make huge improvements in cancer, mental health and maternity care. Professor Anita Charlesworth, the Health Foundation's chief economist, said, "Annual increases of 3.3% a year above inflation are the minimum required to prevent services from further decline. But stemming decline should not be the goal for the NHS in its 70th year. After 8 years of austerity, people are waiting too long for care, the NHS doesn't have enough clinical staff. Public health budgets have been cut and just 4 in 10 people with a mental health problem get any help at all. If we are to make any inroads into these problems and secure the health service for the future, funding needs to increase by at least 4% a year."